Inspection, any ulceration, any nodules, any
Formation.
yes, abnormal things.
Okay. Any discharge, especially for the vaginal examination, discharges you should see. If there is discharge, what is the color, what is the consistency? Okay. Okay, that you have to see. Then
وش يا شباب ذكروني؟
Palpation.
Inspect
الفحص هذا بخلي
ما أعرف له والله.
okay, clitoris.
Yes.
Okay, so you should know the parts of this vaginal examination. Before you go for the vaginal examination, you should know the parts of the female genital system. Okay.
And the examination by hand, I think index and third fingers, and abduction of thumb,
Okay.
and extension of flexion of 5
Flexion of these two fingers.
Yes,
and
like that.
Yeah, extension.
Then insert into vaginal and
degree
about
45 degree, I think.
degree.
Yes.
No, no degree. No degree. لا ما.
Angulation should be there.
Angulation.
Oh, okay, yeah.
Yes.
What's the
Is there an
Yeah,
angulation?
as your friend said, almost around 40-45 degrees. Okay.
Yes.
Okay.
And then
Because it is not horizontal, it is not vertical.
Yes,
Okay,
yes.
so there should be angulation. Yeah. Okay, then
Then examine the walls of the
all of the walls
walls. Okay.
gently and because no eruption of.
Okay. Then
then
how do you? Okay. Go for the palpation.
use measures.
No. First, how do you palpate? How do you PV examination per vaginal? This is called per vaginal
Yes.
examination. How do you do it? How do you pass your fingers?
Pass your fingers.
First, you have to do it with your fingers.
Circular motion.
Then you will go for this. Okay.
We go-
You should not put the instruments first.
Yes.
First, you
Yes,
should
yes.
gently with your fingers. You have to
Yes,
check.
There is ulceration.
circular
or
motion
anything,
for the examination of the vagina.
Okay. So how
Check
do you
the
come from
size.
somebody do it?
واحد
Blood.
Okay, first you do it and we
No, first time. Okay. And you know, and don't be shy about this. Okay. When you are learning, don't be shy.
طارق يلا.
Okay. Come, no problem. Good, inshallah.
As my friend said, we flex his two fingers.
Extension of two fingers and
extension
flexion
two
of two.
fingers. We insert like this with a degree, and we insert and we
No,
examine.
don't go directly. First, apply the pressure on the posterior wall behind. Okay.
How?
Like down.
How,
First,
doctor?
okay, like this. When you do, first go from down, then put your fingers deep inside. Okay. So don't push your fingers directly. It can injure anything. Okay, the structure, because anteriorly we have urethra and other things, which are important.
How the angle? How is it?
Yeah, 45-degree angle. This angle, this is
Like
one.
this.
Okay, this one. But you have to apply pressure on the first posterior wall. Okay,
Yes.
because there are no important structure except the rectum behind it is spacious. But in the front we have the urethra. Okay, so it can get damage. Okay, so you should always put the pressure on the posterior wall. Then slowly, when you put your fingers, then it will slowly slip deep inside. Okay, okay. Then
And then examine the left side and then the
right side. What is that left side and right side? What is that space called as?
Fornix.
Fornixes. Okay, fornix. One is singular.
Lateral
Lateral fornix.
And,
Both the right and left side.
right and left.
and
Then
anterior.
posterior and
Posterior
anterior.
and
Okay,
anterior.
so all these
And
are the
this-
spaces.
Yes.
What is fornix? What is the space between what and what?
Cervix and
Cervix and the wall of the
the wall
vagina.
of vagina.
Yeah, between that space is called as the fornix.
Yes.
So there are anterior fornix, posterior fornix, and lateral fornix on right and left side. Okay.
This is only for palpation.
Yeah.
That's it.
Then there is something called a bulbourethral glands. You can check that also. Pus and
Inside the vagina.
Okay. Then
After that, we have the device.
yeah. Then you take the where is
the
it?
cervix.
Speculum. Okay.
So is it called, doctor?
Huh? It's called a speculum. Yeah.
Speculum.
Okay. Now come.
أنا سويته. مثلا
حطه كذا
we close it.
First close. Yeah.
Yes.
Good.
Insert it like this,
Yeah. Vertical.
vertical,
Yeah.
like this,
Yeah.
and then we
Then rotate.
rotate. Then we open, and then we close it.
Yeah. Close it. Okay.
We can see the cervix.
Yeah. Now you can see the cervix.
Then by
Then
what's called this tool? What's
it's
called?
called as the forceps.
Yes, for anti-flexion of cervix. The upper wall. ما ادري شلون يفتح.
That is the technique that you should know. Okay.
Yes.
So slightly move it laterally, then it will open.
Yes.
Okay.
There was no classes, so we do not know.
You did not have this one
No.
before?
Now we had
Then measures.
not this.
Okay. Speculum examination was not there before. Then why it is there for
Only
exam?
this.
What's called
this one?
This is called as sound.
sound?
Yeah, sound.
Okay.
So why the sound is used?
For measures the wall of endometrium.
Yeah.
Yes. Deepest wall of endometrium. Like that.
So where did you put this one?
Upper wall.
Yeah.
Upper wall of cervix.
Okay, anterior wall. Of
Anterior wall.
Okay.
Then we measure
The sound.
the sound. Yes.
With the sound, you
If
measure
there is,
how much? Yeah.
Yes. There is, for example, 6 centimeter.
Yeah.
We used the intrauterine device.
نخلي سنتي صح؟
هذا تخليه ثابت.
لا لا نقص سنتي.
اي تنقص سنتي هنا.
ما فجأة ولا So always use the glove, okay?
Yes.
Yes.
Okay, okay. Because it is all sterile. It is going inside the body, so everything should be sterile. Okay. So even these instruments should be sterile.
شوف في أحد يعرف شلون يفتحها وستيرايل زي كذا؟ ها؟
أجيبها هنا أخر.
If you want, you can use the gloves. Gloves are there.
No need.
No, always, even practicing, you should practice
Yes,
with all
yes.
them, because at the time of examination you forget many things, and when you are in front of patient you forget more. Okay, so keep.
What's the name of this device?
Which one? This is speculum.
Speculum. And this one?
This is the forceps.
Forceps.
Yes.
This
This is the sound.
Sound. What's the procedure here?
What's the procedure next?
Now
Now you have measured. Okay.
Okay,
So
measure-
again, once again measure.
5 centimeter.
Huh?
5 centimeter. We measure.
Okay, from where? How? Hold
Here,
it here. Okay. 5 centimeters.
6 centimeter. We decrease here 1 centimeter just
Okay.
for endometrium.
Okay.
So how can we do?
So then this was not there for you.
No, we took this one, yes.
Huh? You took this one.
This one, and we took it in intrauterine device.
Okay.
But in the vaginal examination, we only took.
Okay, no problem. These two are separate. We have first, yeah, you have done already. Okay.
Yes.
So then you have to pull this up slightly up. Okay. I think it's not coming. So the length should be measured here. Huh?
Yes.
Which one? This one? This is for pushing. Okay. Then you push from here. Okay.
Then
Okay. Before that, you have to fix this. Okay. Pull it up. I don't know why it is not coming. I think it's fixed here. Yeah, here it is fixed. Okay. Okay, like this. Okay. Pull it up. Then fold it like this. And it has to go like this. I don't know why it is. Yeah. It has to go inside.
of course we do this with the
will
gloves.
Yeah. Always gloves. Okay.
Yes.
So I don't know why.
It will go
This should
inside.
be taught.
We will.
No, always it should be going inside. It will be fixed like this. Then you measure. You keep this distance from here.
Yes.
Okay. If it is 5 centimeter like this, measure it from here. Okay.
4
Keep it or 5 or something like that. Then put this like this from here. Okay. Then go inside. Okay. Put it inside. It should be close. Okay. It is
Yes,
not.
yes.
It has to be close. Then go deep inside like this. Okay. You are going. You have kept it. Now the distance you know. You are not pushing
Yes.
more because you know the distance. Then keep this like this and slowly.
How can I know the distance?
Then no. This has to go up to deep. Up to here.
it will stop in.
It will not stop. You have measured it here.
Yes.
You have marked it here. Now you go up to here. Up to the wall. Outside wall. Now,
vagina.
now it is up to vagina. Okay, border, outer border of the vagina. Now, slowly pull this and push this one. Okay, now slowly release it. Okay, it has to be, actually, it has to, all threads has to go inside. Okay. So, slowly release it. It has gone. I don't know how much it is working. It has all bent. Okay. So, it has to be released there.
Released
Inside it
and
will be
then-
there. Yeah. then you have to cut it.
Yeah.
Okay,
But
the thread size,
left.
the long thread, this thread will come outside. Okay, that thread, extra thread which is there, you have to cut it from here, borders.
Yes.
Okay, when you cut it, the remaining part will be inside. Okay, so okay, so that is how you are supposed
How
to
we cut it by
use. By you have to have scissors. Okay, the extra part will come outside. This part, this is very long. Okay, so only this part will be inside. Okay, this will go and fix in the within the uterus. It will go and open. When it opens, it will be there, sticking there. Okay, remaining part it cannot come here because it is all this thing, so it will come. But in case of actual this thing, it will go deep inside and it will remain there. Then this part might be inside, and the remaining part is also like this. Okay, so the remaining part, when it is there outside, you cut this part, and the remaining part is inside. And whenever you want to pull it, remove it, just put the speculum again, check it, and just pull this threads. It will come out. Okay, that is how it will be used in the examination.
كذا تبغى تدخلها كذا
لا كذا كذا.
Okay, if you want to, once again you can put it and you can practice, try to practice it.
وين راح؟
Again, then you have to remove this forceps.
هنا تكون كذا.
Okay.
Then show us how to put this forceps.
So this is like this. See here.
أدري.
When you hold it, it is very simple. When you, if you are holding it, is very, very tight. Okay, so we will not put it in the hand or something like that. When you put it like this, it is very quick. Okay, here. When you put it, see here, the it has teeth.
Will fix, yeah.
All the thing. Just push it. It will go and fix. It will be painful. Okay, okay. But in case of this thing, it will not be painful. But if you put any other part of skin or somewhere, it will be very painful. So don't never put it on. Okay. When you want to release, just push it like this outside. Okay. Now it will come out easy. Okay. And when it is going, just push it down. Just like this. Okay. When you are releasing, slightly lateral.
Where to apply it in the mother?
In the anterior wall
Where?
of the cervix. Where is it? Oh, let me check. I cannot see that. Okay. So if you hear,
Is it up or down?
up.
Up.
See here. See here. Now like this. Because this has to go inside the uterus. Okay. So we have to hold this up.
Flash.
So
You can see instead of taking the picture, you can
we clip it to the cervix.
Yeah, anterior wall of the cervix.
And we
hold it.
We hold it up.
Yeah, hold it up so that now down you can push the intra-retentive edge. Yeah.
This is for the angles of the cervix and the.
Yeah, it is at the angles.
Yes.
They just to hold the cervix.
Just hold the cervix.
Hold the cervix
Nothing
so
else.
that below that you can pass your these things.
Yes. Follow the measurement.
Yeah, measurement as well as both.
And this we will put it until
measure,
we hit the fundus.
Yeah, inside. Okay, it will go deep inside.
Until we hit.
Yeah, until it goes up to the fundus.
Fundus.
Okay, then measure from here.
Measure.
Okay,
From what?
take this measurement from the
Outside
outside wall. Yeah.
Yes.
Now you know this is so much deep.
Yes.
Then keep this distance here as the measure.
How much?
Okay, so take from here.
Same size.
Same size. Same size. No, same size.
Same size.
Yeah, don't take extra and less.
I think
Take this size.
I think the doctor said increase 2 centimeters maybe.
Okay, if you want. When you cut the thread, then you can increase. Because if you go deep inside, you're piercing the fundus of this. It is already there in the fundus. And if you take extra and push it more deeper, then you can injure the wall of the
No,
uterus.
take less. Maybe say take less.
No, you take the exact measurement.
The exact measurement.
Okay. Then when you are cutting the threads, you can take extra 2 centimeters and then cut. Yeah. Slightly push it laterally.
بيت
Then it
واحدة
will
ما يحتاج.
Now can we go to the male examination?
male examination. Examination, I don't remember. You have the checklist with you?
Prostate gland. Prostate
Huh?
gland. If there is a tumor in prostate
Yeah.
gland.
In the examination. Sure.
Here it is 2 fingers. Here it will be how many fingers?
No finger.
No finger.
One finger.
Huh? How do you measure the? How do you examine the prostate?
2 fingers. 2 fingers.
No, we first inspect the penis and testes.
Okay. Here you can see
Yes.
penis and the testis. Can you make out the prostate from there?
No.
Okay, inspection, palpation, okay, it's inspection, it's okay.
And we have to palpate the testes also.
Yeah.
And the penis.
Okay, you can examine the penis as well as the testes, everything for
Yes.
any abnormality.
And ductal
Okay, everything.
examination. Ductal examination.
Ductal examination also you can do. But finally, how do you do the palpation of the prostate? It is deep inside, right?
Just by one finger.
Yeah. one finger.
Then we measure, not measure, palpate the median lobe of prostate. 3 lobes there is. In the upside.
Yes. Upside and anterior.
And
You-
anterior,
you
yes.
put your finger like
yes,
this,
yes.
then you try to feel. The hard structure is the prostate.
If there is not.
As the age increases, it becomes harder and
If,
more harder.
if it's normal, can we feel it?
Yeah, you can feel it, but
It's
it is
normal.
softer, not so much hard.
Yes.
Harder than the other.
Normal prostate is
Harder than the other structures, so you can make out. So it is anterior. When you put your fingers, it is in the front. Okay.
Yeah.
So the prostate in the front, and you are palpating from behind. Okay. So now you can feel it. Okay. It is harder compared to the other structures.
But
Okay. And it is anterior
it-
features.
It is it soft?
Huh?
Is it soft? Is it-
Yeah, soft like a mass, but it is harder compared to the other structures, all other structures.
As hard as the bone or less?
No, not hard as the bone.
Less.
Yeah. It
Hard
is
for the other organs.
harder than the other substances.
Yes.
Because all are other soft, very soft. Okay, so the rectum and other things are very soft. Okay, the muscles. So in front of that finger, whichever structure is there, and it is slightly harder compared to the other thing. Not hard like bone or cartilage, something like that. No, not like that. It is still soft. Okay, but as the age increases after 40 years, it becomes harder and harder.
And larger.
BPH, it is called as BPH.
Similar to
benign
the
prostatic hypertrophy. So in that it becomes larger as well as become harder also.
Similar to the bone.
Not like
No,
the bone.
no.
Never it like the bone. It is anyhow. It is it is a gland, right?
Yes.
So how can it be like bone? Okay, it is not like bone.
So we check for the only consistency.
Yeah, consistency. You have to see any mass.
Yes.
Okay, when you are feeling for the mass, whatever the palpation is there, you have to do. Okay, one is you see the consistency, then for the mass, and if there is a mass, what is the size, shape, everything.
Smooth.
And when we exert our fingers, we
Save
make
blood.
say blood or
Yeah, you can
something
see the
abnormal,
discharge
yes.
also. Yeah.
Yes.
But here the discharge is not very important because where you are putting the finger?
Prostate.
Rectum.
yes.
So if
So
there is
it's
any discharge, it is from the rectum, not
Yes,
from the
not
yeah.
from the-
Yes.
Okay, but anyhow you can see for the discharge and everything. But whenever you see, because you are putting not in the prostate, you are putting your finger in the rectum.
Yes.
So whatever discharge is coming from the rectum, not from the prostate. So usually you don't see for the discharge of the prostate anyhow. Okay.
And
What else?
inguinal, inguinal,
Inguinal.
tell the patient to cuff to inguinal nerve.
Yeah.
And if there is any infection,
To see if there is a hernia.
yes, hernia.
Yeah. You can see for the hernias.
Yes.
Where?
Hernias, this is the inguinal ligament.
Yes.
Okay, this is the inguinal region, and here hernias will be here,
Yes.
near the penis, the root of the penis. Okay, median and lateral. It is called the direct.
With
and
your
inguinal.
finger here.
Yeah.
Put the hand or the finger? I think it's a
Yeah,
hand.
you can feel it.
Yes.
Okay, and
But
ask the
then-
patient to like
Cough.
cough.
Yes.
So if there is any hernia, it will become larger.
And if it's pushback.
Yeah,
When he
and
coughs.
when he stops coughing, it will go back.
Yes.
Okay, that is called there are different types. That is called a reducible type.
Normally, what you feel if he cough?
It will becomes larger.
Normally.
Yeah.
Yes.
Not normally. This
Push
is
your hand.
inguinal hernia
Yes, yes.
itself is a abnormal thing.
Yes,
So,
I
He's
know.
asking if,
Okay.
But
if he
okay.
coughs.
Okay. If he coughs, there will
Normally.
be enlargement of the hernia. This is
No,
Abnormal.
If he's normal.
normal. No, nothing.
If
If you
Not-
cough, no, it will not. Nothing will happen here.
Not
But when there is inguinal hernia, the patient will cough, then it becomes larger here. There will be a swelling, small swelling, but it becomes larger. But again, there are types. Okay, that is reducible. In case of reducible, after coughing again it will go back and it becomes small. But in case of irreducible, there is no change even with cough or with the lying down. Okay, it will be large itself. Okay, that is called irreducible.
خلاص.
And the examination of varicose and hydrocele from
Huh?
the testes. Varicose and hydrocele.
Yeah. That
by
hydrocele you can see just by the
Yes,
Light,
by
light.
X-ray or by not X-ray. I'm sorry. By
Light.
the light.
Yeah,
Yes,
you can pass a light. That is called as the test of
I think you can like
yeah,
this.
make it take a paper or a roll and pass the light from one side
Yes.
and see from the other side.
And we also
Okay.
palpate the testis for the
Yeah.
vaccine.
Yeah. For the
Droxy.
varicocele.
Enlargement of,
Yeah.
vein.
So yeah. So how do you feel it?
Like this.
Huh?
Like whole.
Like worms. Okay. Like
Worms,
group
yes.
of worms in a pocket. Okay. If you
Yes.
put lot of worms, earthworms, you know, which are moving. Okay. In a small packet, and if you try to feel, how you feel? So in a similar fashion, huh? Okay. Just imagine. Okay. At least imagine. You
Yeah.
did not feel it. Okay, not me, but still you can imagine. Okay, so it will be like worms, lot of worms. Okay, okay, that is hydrocele. Varicocele. Worms, yeah, worms will be varicocele. Varicose veins. There are veins which are varicose. What do you mean by varicose? They become tortuous, enlarged because of the why they will become tortuous. No, of the valves of the vein. Veins are valve. They had to pump the blood against the gravity.
Yes,
Okay. If there is loss of the consistency of the valve of the, it is not working properly, then the blood will come back, and that's why it becomes enlarged. Okay. So there will be varicosity. It will be like worms. Okay.
So the treatment.
Treatment. Okay, there are treatments. Okay, that you will study later. Okay. Okay. There are surgical treatments. Okay.
What is hydrocele? Hydrocele.
Hydrocele is the accumulation of fluid within the pouch of the.
Another one is examination of penis of their discharge.
Yeah, we can see for the discharge. See the penis, whether it's circumscribed, any mass,
And by
anything, any
hand
change.
to
Yeah, you can feel also, press and feel. If you press it, there might be a discharge coming out.
Yes.
Okay, that you can see.
and if there is discoloration or ulceration.
Always. For any examination, inspection, you have to talk about the discoloration, any mass or swelling.
لا ده في تسحب كذا الظاهر. والله
What else?
There's the cannula, doctor.
Cannulas,
Yes.
that's what I was searching, it was not there. And Dr. Awad is not taking the call, I think.
Doctor, what's شو اسمه other disease of
He should keep all the instruments here, whatever is necessary for your examination, and you can do a revision.
yes.
And he's telling everything is in the lab.
We
there.
revise with ourselves, with each other.
So
Doctor, about the female, if they ask if the female is a virgin,
Virgin, yeah.
how can I use it?
Then you will see something called as the hymen. Hymen. What is hymen?
بارير.
You are married? No, not married. Okay, so you are confirmed.
This is the cannula, doctor.
Yeah, cannula is there. Okay.
But we need the
But
arm.
we need the arms there. Arms are there.
Is there an arm?
Arm is there, but I think the blood is not there, so you cannot check for this thing. Because if it is, whether it is in the vein or not, you cannot
Yes,
confirm.
we need that, but
But you cannot confirm without the blood.
موجود?
Okay, if you go and bring the limb, you can try this. Okay.